Good afternoon. My name is Staff Sergeant Hillard, and I am going to be presenting to you today a very important topic, one that we can all identify with, addiction, chemical dependency, substance abuse counseling. In this presentation, we're going to show you some before and after. We're going to go over some pop quizzes and a little more information as I go further in detail. As you can see here, we have a person who decided to take ecstasy, and as a result, now she's paralyzed, and this is her before and after picture. Okay, pop quiz. Ready?
Get ready.
So according to Teen Rehab Center, as of February 2018, what percent do you believe students smoke weed in comparison to 48%? What percent do you think smoke weed? I'll read it to you. According to Teen Rehab Center, as of February 2018, at least what percent of A students smoke weed recently in comparison of 48% of D and F students?
5%.
Okay, you say 5?
Yes.
What do you say?
I'm gonna go with 10.
10. You're correct. 10%.
Oh, 10%. Okay.
All right, next question. Someone read that for me. Harrison, can you read that?
I can't read it that far.
You can't see that far?
According to one study, 12th graders who smoke marijuana are blank percent more likely to crash their car. I'm gonna say 20%. B.
What do you say?
I would agree, B, 20%.
Harrison?
I want to say 1%.
Okay. The answer is 65%.
Oh, wow.
It's a high percentage.
Yeah.
High percentage. Okay, so next. So this question, I'll read it. According to a high school drug use survey from the National Institute of Drug Abuse, especially among 12th graders, which drugs is the next popular in high schools? Is it A, methamphetamines, Adderall, opiates, painkillers, synthetic marijuana, tranquilizers, cough medicine, Vicodin, all of its subsidiaries, B, all of the above, or C, none of the above?
I'm gonna say. What do you think?
I'm gonna go with C because I feel like, it does have marijuana. So actually, B, all of the above? B or A? Because
What do you say?
All of the above.
I would agree, all of the above.
You are correct, all the
Okay,
above.
okay.
Yeah, that's correct. Okay, so now we're gonna go over some learning objectives. As you see here, hopefully at the end of this lesson, we'll be able to distinguish differences and changes in behavior, science of drugs, and perception, and evaluate how this relates to dealing with one's addiction. We also want to identify an example of addressing addiction and drug awareness to aid in responding assertively to addiction, and of course, practicing resilience. Here's a short video that I want you to watch, and afterwards, after the video, we're going to comment on some things that we noticed in the background.
Press escape.
Sorry.
Go to Google. Go down at the bottom to Google.
Over here?
All the way at the bottom. Yes, and press play.
Thank you.
The IRA, hidden in plain sight, is an educational example of a teen's bedroom designed to help teach parents about drugs and their children.
We bring parents in to show them where to find drugs if they suspect anything, or even if they don't suspect it, we should also check our kids' rooms.
It's set up so that the parents actually walk through, they can tell you open drawers, they can pull the bed apart, move the pillows apart, but they can go through and they can actually look for the different types of drugs, paraphernalia, the signs that they would, give you the clue to even think of going in and really ripping your kid's room apart.
Is there any reason why your daughter would have that?
No, I hope not. Of course, a program like this begs the question, do parents have the right? Is this an overreaction that may break down privacy and trust between parent and child?
The education and the awareness that you get
apart. Why? There's a lot of locations that parents wouldn't think to look. You always want to check their drawers, you want to go through all their clothes, you want to touch everything, feel everything, shake it out, and you actually want to inspect the drawer. You want to go underneath, check the back, make sure nothing's taped to it, so they can't hide anything. A lamp. This can be any kind of lamp. This is a lava lamp. Check it. Everything comes apart. It's just a water bottle. You can actually drink out of it, but it's a hidden compartment, and drugs can be hidden in it. You're going to check the shoe. Just because it's a shoe and you're shaking it out, nothing's coming out. You're going to still check and peel things apart. You want to search everything. You just want to keep going.
As far as parents are concerned, privacy is not an issue. This is about awareness. The lives of their children are at stake.
Going through the clothing, finding things that was so informative. Opening water bottles and things and inside of chip bags. I would never look there. It was so good.
Trash, yeah.
Who's never been around a drug before gives them an idea of what to really look for when they're in their kids' rooms. You know, it may have said red flags just walking around the day and see what was really out there. Kids have much more freedom now. They have many more things. So they're able to hide the drugs more places. I thought it was very informative.
Getting our adults to come out and actually experience this, it puts them in a whole different world. They leave like, oh my gosh, I never would have thought. I never would have known. I wouldn't even think to look there. It's important to check their phones, check their rooms. It could save a life.
Okay, before we go to the next slide, Emily, tell me, what did you get from this? Did you learn anything from the video?
I would not have known to go through someone's trash. Like, you just look at trash and you just see, you know, like a chip bag and, you know, I wouldn't think to go through someone's trash, so.
To the presentation.
Bethany?
Checking underneath the drawer. I wouldn't have ever thought that.
Like going through someone's drawer?
Yeah, because it said take it out, look underneath it, it could be something taped. And I was like, oh, I never would have
Oh,
thought
yeah,
that. As I
yeah.
looked in the drawer. Like, oh, it's empty. Okay.
Harris?
One thing I learned is, one, the parents even said it is because our age and our like time now, we have a lot more things we could hide behind, and it's kind of smart that they are showing how to check through everything, because your kid could be doing it and
Right,
you could
and
save
you
their
never
life.
know. Exactly. Before we go to the next slide, thank you, each of you. There's some signs that I want you to tell me that you think that you've noticed with someone. I mean, for instance, I'll give you one, neglected appearance, someone that, you know, you're looking like, whoa, something's going on here. So, Emily, any signs that you notice that would trigger that someone may be using or abusing drugs?
Just from, you know, past experiences, I think like irritability,
Irritability?
like mood swings,
Mood
you know,
swings.
just something that's just out of the ordinary, just not right for that person.
Right, if they
Yeah.
were naturally
Yeah.
a person you knew and they were pretty stable, because some people could be irritable for
Just,
mm-hmm. different reasons, but
Yeah,
someone that, like if you notice Bethany coming in, all of a sudden she's just totally different. You know? So, but that's a good one, Bethany.
I would say either extreme weight loss or weight gain.
Good, that is good. Can we go to the next slide? And we're gonna read some of those. Neglected appearance, poor self-image, violent outbursts, and just, we mentioned the weight loss,
Oh, yeah.
and you can see the rest of them. There's a couple others, glassy eyes, big eyes, you know, just erratic behavior. You know, that's the first thing that we notice. Hey, something is not right with Tony or Jim or whatever their name may be. So, okay, good. So here are some definitions of substance abuse. Emily, can you read that first definition for us, substance abuse?
Yeah, so substance abuse is when a person uses a compound without any legitimate medical need, or when the compound is used in excess of the social standards.
Okay, and I'll read the next one. Addiction dependence is a complex condition or a brain disease that is manifested over time by a person involved in compulsive substance despite the harmful consequences on the body. And Harrison, could you read tolerance for us?
Right. tolerance is a term of using drugs is tended to develop over time when a person must use more of the compound to activate and desired effect.
Okay, so now we got some terms, substance abuse, addiction, and tolerance that you are familiar with now of the definition. So drug affects teens in different ways. There's emotional problems, behavioral problems, addiction and dependence, and risky sex. So what do you think about the emotional problems of it? As you look at the definition, what do you think about the emotional problems of? I can tell you one. I talked to several people. I interviewed myself on 115th Street, and a lot of them have emotional, not just emotional problems, but mental problems, and that is a big. They're not able to make a decision on this. Hey, look, it's something that we're all doing. I mean, that's going on down here. So I think that it's something that they just do based on the environment or, just, but there are all different types of problems, and emotional depression can be, anxiety can be, behavioral problems. Some of these were behavioral problems that we mentioned, like behavioral social problems. Risky sex, what do you think about that? As risky sex, how does that?
Maybe if they're under the influence of a drug, they're not
Exactly.
thinking.
Being under the influence, just like whatever, it does, it doesn't matter, just as long as I get whatever drug I need to comfort me, and it puts them in danger. So, good. Excuse me, very good. So, and also continuing on, we have learning problems and diseases, brain damage, and car accident. And when I think of the one that stands out the most to me is brain damage. We've all seen the video where it says, "This is your brain on drugs." Where they take the egg and put it in the skillet and they're frying it, So I think that that's when I look at all of these definitions and I see brain damage, that's one of the ones that first come to mind, like, wow, because you can never regain those damaged cells, damaged neurons. You can never regain them once they're destroyed. So, excuse me. So let's look at some of the common mistakes next slide. And so, can you read some of those, Emily, common mistakes?
Yes, so common mistakes parents make, ignoring mental health issues, assuming experimentation is not a big deal, being dishonest about your drug use. So, would you like me to continue through the whole? Blaming yourself or your spouse, setting a bad example, failing to consider risk factors such as early aggression or destructive behaviors, depression and anxiety. Another mistake is not locking the medication cabinets.
Okay, and we've all experienced all of those. I mean, or incident in the news where someone says, "Oh, I didn't lock the cabinet," or excuse me, sorry, or their child has some form of ADHD that was never looked at or treated. So that could be negligence on the part of the parent, and that's a mistake. Those are mistakes that parents need to be aware of. So we're going to continue on with some mistakes, and Bethany, if you could read those for me, please, some of those mistakes.
Confusing intelligence with maturity, failing to consider family history, not noticing changes in your teen, putting off getting help, and not talking about driving.
What do you think not talking about driving could be a mistake or some type of, why do you think that could be something based on what you see? How could that be?
Not talking about driving, possibly not bringing up the issue of driving under the influence. Because, usually parents just want to talk about follow the rules, make sure you use your lights, stop when you need to stop, but they never talk about, how drastically different it is if you were to take something or drink while you're driving. So
right, because it could really impair your ability to have the same motor skills
Yeah.
as you did
It's just not
without.
like a big focus, I think, for parents, yeah.
Right. Good, very good. At this time, we're gonna do a group exercise. We're gonna pair into twos. Well, we'll have the camera person and you two together. So, and the students will write down some effective ways. Write down effective and confront a teenager doing drugs. And then after that, we're gonna stand up and see what you discovered. So, Haverson was kind enough to have some paper that he's gonna pass.
Thank you, sir.
Thank you. And if you need a pen, I have one.
Okay, yeah.
So thank you.
Thank
Yeah,
you.
you have a pen?
He's
Yeah,
ready
I
to
do.
go.
Ready to go. So write down some effective ways that you will confront a teenager doing drugs, and you got 2 minutes to do that. So.
And then incidents that we're gonna write down like the ways to confront a teenager doing drugs.
Like, personally, because I had family come from them, I just brought it out on the table. Put it out.
Okay, put on the table.
Yeah, don't try to be around the bush with it.
Confrontational. Okay, so confrontational settings, so that way they don't feel like they're
Pretty much summed it up nicely, put it on the table.
Another way is, I, again, personally did it, is offer them
So what about
like to help them.
Okay.
So like after putting on the table, tell them like, oh, I know this, like straight up you're on drugs, but if you want help, I'm here.
Okay, that makes sense, that makes sense. I would say,
trying to
confront drugs, yes, be prepared for
so
backsplash.
yeah, so approach them and
But I will say, come with facts.
I'm trying to think like in a way
Yeah.
you can just approach them and they're like saying what
Yeah, come with
kind of like
facts, be ready
respect to
to
explain like
present facts as it is.
Okay, you have about 10 seconds to wrap it up.
Okay, that's yeah, come with facts.
okay
Yeah.
Okay, at this time, one of the representatives from your group will come up, whoever you choose to be the spokesman, and talk about the things that you chose. And Harrison, you can go first if you like, or
you got this there.
Yeah.
Sorry.
So what we came up was put it straight up on the table. Don't be around the bush.
Okay.
After you do that, offer them help, because you don't want to just leave them hanging, pretty much. And then come with facts, because if you're just assuming someone just because they stayed up too late one night, they have red eyes, and you're just like, oh, you're high,
right,
it's not gonna get anywhere. And then
then you have
bond
distrust,
kinda,
right?
yeah, starts there.
Destroyed your trust factor. Very good, good. Okay. Okay.
To kind of piggyback off of what you guys said, to come with the facts, you know, we talked about speaking to them on the same level, not being overbearing, you know, like if you were to find something, you know, talk with them, maybe educate them about it, make them feel like, you know, you respect their intelligence. Another is to approach them in a non-confrontational manner. You know, don't get yourself upset to upset them more, because then maybe they won't respond to you well. So just make it like maybe a one-on-one setting. Don't embarrass them in front of other family members, or just keep it like in a safe area.
Very good, very good. Give yourselves a hand with that. That was very good and thought-provoking. So, at this time, we're going to talk about awareness and confrontation. That's some of the things that you guys have already touched on with your 2-minute presentation. So, awareness and confront a teenager with a drug addiction. One, we want to speak to the person when they are sober. want to expect anger from teen, but remain and stay calm. Focus on how their addiction makes you feel. Try to listen to the addict. Gather information. You want to set boundaries, being home before curfew. Define consequences. In addition, if things get completely out of hand, seek professional help immediately. So I think it's good. One of the things here that stands out to me is setting curfew. And because if they can obey your rule with that, that's a good sign that they have a trust with you, they want to respect what you're saying, and they're just not out doing what they want, because that's a higher risk for something to happen. Not that it will, but I think that that is a good sign to look for. Hey, look, I'm gonna give you a guideline, and if you do good with this, then we can move on to something else with more trust. I think that kind of invokes trust in the relationship too. Okay, so we have a second video at this time.
Press escape. Click on the second, go back to Google Chrome. Click on the second tab and then press enter. No, up top.
I think I exited out, so can I just copy this?
Yes.
Right, just copy it into that. Copy and
Okay.
paste it.
And then I'll paste it in the
Thank you. So it's not my computer, but anyway, someone knows how to use it. Okay, good. So we'll watch this video and then we'll.
Hey there, I'm teen behavior expert Josh Shipp. Today I'd like to discuss the behavior and patterns associated with alcohol and drug abuse and how to help a kid with a potential addiction to drugs or alcohol. First off, I want to explain how addiction to drugs and alcohol works. First of all, kids start to use drugs out of curiosity and typically have fun. Then kids continue drug use to stop feeling bad. Drugs and alcohol warps dopamine production. The dopamine is sort of the happiness chemical in your brain that makes you feel good. So when your kid uses drugs or alcohol, the dopamine levels get drastically altered. And in many cases, the only way they can get dopamine to be produced is through drug and alcohol use. Many addicts would say things like, I can't imagine having fun without drugs. And they're right. The natural pleasures in their life are sometimes no longer enjoyable. And when that happens, then they would experience kids using drugs simply to feel normal. Now, this is all about brain chemistry. The kid needs the drug just to retain the levels of normalcy. This is how drug addiction works neurologically. Excuse me. Now, as a parent, here's what you need to do. If your kid is addicted to drugs or alcohol, things obviously must change. Parents need to change the natural parenting role with a kid who is addicted. You should no longer see yourself as a caregiver, but rather you need to see yourself as a landlord. Here's what I mean by that. When a mom or dad is experiencing care for your kid, wash your clothes, clean your room, give money, these sorts of things, a teen who has a drug addict will actually take advantage of this parental instinct and use this weakness to get what they want. They get money out of you, they get bailed out of trouble, these sorts of things. So, in this shift in role, see yourself as a landlord, not as a caregiver. This prevents you from enabling your kid to continue their addiction. The landlord approach keeps things more manageable. So, this is going to include clear written boundaries with non-emotional consequences
children, but with a sibling, like that would be like very difficult to give them that tough love, because you want to help them, like you see that they're hurt or you see that there's something going on. So, but it's brilliant, because you will get a reaction out of that.
Exactly.
Yeah.
I'm glad you said that I think the main thing, you mentioned something, and that key word was when they feel like, well, you're the parents, and they feel like, oh, well, they love me anyway, they're gonna do, but doing that contract is saying, hey, look now, it's turning it back and saying, this is something you gotta fix. You gotta almost withdraw, and that's hard for a parent to do. It's almost like cut off and say, okay, you got the